Hello, everyone. Welcome to our webinar on Harm Reduction Works, a call to invest in a European health-based drug policy. For those who don't know me, my name is Marie Nougier. I'm here representing the International Drug Policy Consortium. For those who don't know us, we're a global network of NGOs that come together to promote drug policies that are grounded in health and human rights. So thanks a lot for joining us. Thanks so much to the co-organizers and thanks to our amazing panelists. Before I give the floor to our speakers, let me share a few logistical points. First of all, this webinar is being recorded, so it will be posted on the Correlation EHRN website, so please keep an eye out for that. Secondly, do feel free to introduce yourselves in the chat. I see somebody's already started, but it's always nice to see who's on the call, where you work, where you're from. And also feel free to share some of your experiences in country as our speakers are talking today. You can also ask questions or post comments directly for the panelists in the Q&A. Please do that in the Q&A because it's easier for us to collate all of them, and then we can go back to that either at the end of the webinar, hopefully we'll get a few minutes, but also the panelists can then answer you directly into the chat. So it gives them an easy way to kind of like answer to your questions and concerns. So why are we here today? The reason why we decided to organize this webinar is because the EU's current drug strategy is about to expire at the end of 2025. And so it's embarked right now in the process of drafting a new one. And so this is an opportunity for us to look back at what's been achieved, what's worked well, what hasn't worked well, and what should be the key priorities for the next few years. And importantly, this drafting process is really taking place in a complex environment, both at the EU level and also internationally. So first of all, even though the current EU drug strategy is probably one of the best one of the most progressive ones that we've had to date, in particular with a strong focus on health, on harm reduction, on human rights, its implementation has actually been very, very much focused on law enforcement. And overall, there is, I think, from civil society's side, a concerning move from the EU to focus more on securitization than on health. And this can be very much felt in the field of drug policy in particular. Secondly, internationally, there is an increasing recognition that the global drug control regime, which has very much focused on prohibition and law enforcement again, has failed. So I think you've all seen, maybe most of you have seen it, but the World Drug Report has been launched today, the new version for 2025. And it shows that the global drug market continues to thrive, despite the huge amount of money and effort spent on prohibition. At the same time, the UN and civil society continue to document the widespread and far-reaching impact on health and human rights of punitive drug control. And this has led this year the Commission on Narcotic Drugs to establish a panel of experts that will be responsible for an independent review of the UN drug control system in the next 2 years. So that's an opportunity to see again what's worked and what could be done better. At the same time, civil society, affected communities, and harm reduction service providers are also facing a very deep crisis. Civil society space is shrinking. There are crackdowns on people who use drugs. There's direct attacks on our work as civil society, both within and outside of the EU. And we're facing a very worrying shortage of funding for harm reduction and for drug policy advocacy. Today, we're holding this webinar as part of the Support Don't Punish Global Day of Action. For those who don't know the campaign, it mobilizes thousands of advocates from all over the world on 26th of June every year. 26th of June is World Drugs Day. And the idea is to shift the narrative to promote drug policies that are grounded in health and human rights. So in the coming days, there's going to be actions in over 256 cities in 77 countries. If you'd like to take part in the campaign, you can take a picture of yourself with the logo of the campaign and send it back to us at campaign@idpc.net. I'll put the email in the chat. So in this particular webinar, what we really want to do here is to promote a balanced approach to the next EU drug strategy that prioritizes health and harm reduction and evidence, to advocate for a shift away from punitive measures and towards decriminalization and legal regulation, as is now being recommended by the Office of the High Commissioner for Human Rights, to ensure strong and meaningful participation of civil society throughout the drafting and implementation process, and to promote sustainable funding for health and harm reduction. The webinar is part of a series of events and actions that are planned within our new European drug policy campaign, which basically aims to influence the contents and implementation of the EU drug strategy. And to learn more about that campaign, I'm going to give the floor to Catherine Schiffer, who is the Director of Correlation EHRN and the main organizer of this webinar. So Catherine, thanks for coordinating us. Thanks for organizing this. And can you please tell us a little bit more about the campaign?
Yeah, thanks, Marie, and welcome to everyone to this webinar. I'm really happy you are here in such big numbers, especially at the day Support Don't Punish, because I know there are many different webinars and events taking place. Yeah, I can tell a bit about the drug policy campaign, but again, Marie already explained a bit about the background, why we are doing this, why we have launched the campaign, that indeed the EU drug strategy, the new one, is under development. The current one looks good on paper, but if you look to the implementation, we feel that there is a different story. There is a disproportionate focus on security and law enforcement, and this comes at a deadly cost to our when it comes to us, because we see this imbalance does not make society safer. It has failed to deliver more security. In fact, it's quite the opposite. So organized crime is thriving. We see they earn millions of euros or dollars. And at the same time, we see that health and harm reduction interventions and services are critically underfunded. And again, the drug markets evolve, and there are new drug trends which actually would expect and would require much more investment also in innovation and in harm reduction. So this webinar is part of a broader drug policy campaign, and it's backed up by a coalition of more than 30 European harm reduction and drug policy organizations and networks. The initiators include Correlation, European Harm Reduction Network, Eurasian Harm Reduction Association, International Drug Policy Consortium, the European Network of People Who Use Drugs, and also the Helsinki Foundation of Human Rights, and many other organizations who supported us during the campaign by sharing all the resources, the policy papers, sending out letters to European parliamentarians, to national parliamentarians, national drug coordinators, and so on. We started this campaign already in 2024 with the launch of the European Drug Policy Manifesto. Some of you might know it and probably also signed it. It was quite a successful campaign because we had more than 800 signatories who supported it and endorsed it, including members of European and national parliaments, civil society and policymakers. And with the current campaign, we build on that momentum, and we call different and all relevant stakeholders actually to support us. And this includes, again, the European Parliament, the European Commission. DG Home is here today, but not only DG Home, but also other directorates and departments, EUDA and other relevant agencies, EU Drugs Agency to be more complete, the EU member states, civil society, and clearly also people who use drugs. And we hope that all of these stakeholders will support us in our campaign and also today. Very shortly, Marie already said it, what the key demands in our policy paper, which are also shared in the chat. Make drug use a health priority, meaning to give also universal access to proven harm reduction intervention, including needle syringe programs, drug consumption rooms, drug checking, take-home naloxone, and also integrated HIV and hepatitis programs. stop and shift from punishment to public health by decriminalizing drug use and by exploring regulation models that actually weaken organized crimes. Ensure a balanced EU drug strategy with health, harm reduction, human rights at its core, and establish a dedicated EU fund to support civil society and innovation in a health-based drug policy. And again, this means also that different departments and directorates in the European Commission cooperate and coordinate their efforts. So, closing, this campaign is urgent and it's important, not only because the new EU drug strategy is there, but because harm reduction is under threat. We see a rise in populist and far right-wing governments and movements that seek to silence civil society and exclude those who are already very much marginalized and vulnerable and who don't fit into this concept of this new movement. So now more than ever, we need your support, we need solidarity, and we hope that this webinar will help us and is a good start for this process. I would like to thank all our partners and colleagues who participated in this campaign and still will participate after that. And also a special thanks to all you as speakers to be here and contribute to this webinar and support us. I give back the word to Marie.
Thanks so much, Catherine. So now let me introduce our amazing speakers for the second part of the webinars, who basically are going to have 5 minutes each to answer one question and reflect on the future of EU drug policy. So we have with us Alexis Gosdil, who is the Executive Director of the European Union Drugs Agency. He has been there since 2016 and will serve until the end of 2025. So I take this opportunity to thank you so much, Alexis, for all your support for harm reduction, for civil society. You've been an incredible ally, and we're going to miss you. Our second speaker is Masha Iwulska. She is the chairwoman of the European Network of People Who Use Drugs and also an active member of the Polish Network of People Who Use Drugs. We then have Joe de Kock, who is the head of mission at the European Commission, the Directorate General of Migration and Home Affairs from the Organized Crime and Drugs Unit. We're really grateful for you to be here with us, Joe. I know sometimes it's difficult to be part of these webinars, so thank you so much. We then have Ion Oriadon, who is a member of the European Parliament. He is from the Labour Party in Ireland and has an interest in drug policy. Again, thanks so much for being here, because I know it's also hard for members of European Parliament to dedicate time for these events, so we're really grateful. And last but not least, one of my heroes, Lynn Ruan, who is an Irish politician and who has served as an independent senator for the Dublin University constituency in Shanand, Iran, since April 2016. So let me first turn to Alexis. So Alexis, what is the current evidence about the impact of harm reduction in Europe? And what does it tell us about whether harm reduction should be at the center of the new EU drug strategy?
Can you hear me? Good morning. Yes, so first of all, I want to thank you for your invitation, but also for the fantastic cooperation we managed to develop over the last 10 years. And I think one of the recent changes and results of that cooperation is that we had the chair of the European Civil Society Forum on Drugs that was invited again to the special session of our management board last week. So the first one was Catherine last year, and now it was Jana. And I think it was a very, very interesting discussion and very important, not only as a symbol, because it's not just to be there, but also to take part in the discussion. So Jana, thank you for coming. First, to answer to the first part of the question, yes, there is a strong scientific evidence showing the efficiency and effectiveness of harm reduction intervention. But the truth is we don't have the same level and the same quantity of scientific evidence depending on the kind of interventions. And already for opioid agonist treatment and substitution treatment. It took many years, but there is a strong scientific evidence. Now, if you ask me, as my background, I am a clinician, I never considered substitution treatments only as a harm reduction service. It's a treatment service. And I think it's not good for those treatments to qualify them only as harm reduction intervention, with due respect for harm intervention. So, and it's the same for needle exchange programs. And the scientific evidence is over the last 30 years that it was developed. It's less obvious for more recent interventions that are spreading slowly but surely, but are not yet mainstream. I think in particular about naloxone, despite the fact that there is an increasing amount of scientific evidence, but also drug checking services and drug consumption rooms. And therefore, it is extremely important, and this is why it is one of the priorities of our agency to provide the methodological support and to strengthen the cooperation with those different networks, with the drug checking network in particular, and the drug consumption rooms, to help develop and identify the best possible indicators of performance. I think it's essential today because there is a lot of problem. I was invited 3 weeks ago by the Parliament of Wallonia for a 3-hour session with the health committee. There were a lot of questions about the effect, the impact, or the absence of impact of the DCRs. And I must say that one of the problems that was obvious in the discussion was that some of the arguments that have been used to make them allow for the opening of the drug consumption room were in fact suggesting expectations that nobody could expect from the drug consumption room. So I think that's really key, important point in many places. For me, the risk is the best way to kill the drug consumption rooms is to pretend they can have the results that there is no way for them to obtain. And it can be done on purpose, just to disqualify them, but maybe an excess of enthusiasm can be also harmful. And this is why one of the points on which we insist, and certainly in any time I am invited to, or colleagues are invited, we insist, is that drug consumption rooms and harm reduction interventions, they are part of the solution. And if some of the services don't find themselves, they are part of the solution, then I would say they risk one day to become part of the problem. But they need to be part of a holistic approach and a portfolio of services. And certainly in the design of those portfolio, especially at local level, we need more services, we need more integration, we need more cooperation, and we definitely need to integrate and to recognize where there is a problem with violence and ultra-violence. Is not only harm reduction or prevention who can address that. So if we want to ensure the positive and holistic development of drug policy in Europe based on what we already managed to improve the last 25 years, nothing is perfect, but we have some good achievements. I think it's really essential to build and to take into account the different elements of the problem. And this is why sometimes I say we need to reinvent harm reduction and also to integrate what in French, when we created harm reduction in Belgium, for instance, we spoke more about risk reduction and not only harmful consequences. And I think today, if we assess the risks at local level, well, the risk, violence is part of the risk. And how the services can combine the resources and overall contribute to a better offer and, of course, a human rights-centered offer of services is very important. To finish, I would say that what we have also achieved the last 25 or 30 years, even if far from perfect, is the fact that there is an increased recognition of the importance of the participation of people with a lived experience. And I want also to say that many of them may pay with their life a huge cost. One of the last activists we lost a few weeks ago is Peter Crican. So I want to pay a tribute to him, but through him to all the others who have been those who forced us to look a bit differently over the last 40 years about what is the drug use problem or situation, and to consider people who are using drugs as citizens like the others. I think that it's important to highlight that the EUDA is contributing and providing all the scientific evidence for policy making and supporting the EU institutions and the member states. We are actively supporting the last 6 months. It was with the Polish presidency of the EU. Now it will be with the Danish presidency. I think one of our key messages, as I need to finish, I know, it's we need to take into account that we also need to reinvent harm reduction, because we don't speak anymore only about heroin. And I must say, I'm sometimes a bit nervous or a bit, unpleased by the fact that there are some discussions about needle exchange or things. It's not worthwhile to put into question again, but we don't know what to do with the new harms and the new risks associated to new substances and to police substance use. So we need to be creative, and we need, I think, all of us, one of our major challenges in Europe is to update the software, to understand that many of our things in our mindset, they are related to the heroin epidemic. It doesn't mean that we need to forget it and to do something completely different, certainly not. But we need also to learn from 35 years of policy and cooperation on drugs in Europe, also to avoid that next time there is a new threat or a new risk, that we would pay again with more lives lost from people who are using those substances. And to finish, I want to say that we need also to be aware that policy and drug policy in Europe is being operated and is the competences at different level. The EU and the Commission, they have a role by the treaties. They have a role of coordination and support, but most of the competencies are in the hands of the member states, which means that we need to find ways to provide the support, and at the same time, it's not our role. Some people may find and say, unfortunately, but I respect their opinion. But me, as the director of the European Drugs Agency, I must say that we are there to provide all the support to the EU member states. We are not there to dictate them what they have to do. And that's important, because that is allowing all of us, it allowed us to build the strong service and reputation of the agency for the member states, for the practitioners, and also hopefully to be useful for people with lived experience or using drugs. But knowing that actually the main factor for the progress we had in Europe was that nobody has the competence to oblige all the others to do differently. We may regret there are some risks associated to potential or already existing policy change at local or national level in some countries. But the main factor that allowed us to progress together, including to have resolutions and common positions explicitly, including harm reduction, which was not the case before and what has been very difficult to achieve, is that we work through close cooperation, coordination, support, pushing forwards the evidence. It's not a question to be passive, but knowing what are the boundaries and the limits of our mandate, because at the end, this is what makes our credibility, and the fact that when we are asked an opinion, people see us as being objective and respecting the level of competencies and the subsidiarity. I think it's part of the European model, and I think so far, again, the model is not perfect, but we managed to make a very good progress in the last 30, 35 years. So we need to build on it. Thank you.
Thank you, Alexis. Thank you so much. And moving on now to Marcia. Marcia, thank you so much for being with us today as a representative of people who use drugs. And as Alexis said, just want to echo your voice is just so incredibly important. And I'm so glad that you're here with us today. Could you tell us a bit more about which are the key policy gaps that currently undermine the rights and health of affected populations, in particular people who use drugs, and how these should be addressed in the next EU drug strategy?
Hello, thank you for having me here. And I will be reading because my English is not fluent enough to express all, and I want to be understood by you. So my name is Marianna Iwulska, and I speak today as a chairwoman of Euro Input, the European network of people who use drugs. Thank you for this opportunity to share our response to these important questions. This statement reflects the collective input and shared voice of our members. We had a discussion on Signal chat and also shared Google Disk for this statement. The policy gaps in the UE approach to drug use are not just technical oversight. They are structural failures, failures that continue to cost lives and violate fundamental human rights. It's time for the UE to take seriously the conversation around responsible drug regulation. While some member states have begun to proceed, it remains taboo at the EU level. We believe that member states should end the criminalization of drug use and of people who use drugs. Continuing to criminalize people while claiming to support their health is a contradiction that must be resolved. We think that this contradiction persists because people who use drugs are excluded from the decision making that affects our lives. In many member states, we are still patronized, stigmatized, or ignored altogether. Decisions about our needs are made without even asking us about our realities. That is why inclusion of harm reduction in EU document is a welcome step, but rhetoric must be matched by action. And this action must include a clear and inclusive definition of harm reduction, one that recognizes not just the health need of people who use drugs, but also the harms caused by punitive drug laws and law enforcement practices. We need clarity and responsibility. Second, sustained and meaningful community participation is essential. Grassroots organizations, especially those led by people who use drugs, are often underfunded, fragmented, or excluded. Without us, there is no education campaign. Monitoring system fail when they ignore the early warnings that come from our lived experience. That's why we call for peer-led monitoring. We often hear government claims that harm reduction is embedded in national policy, but the reality on the ground tells a different story. We are the best judges of what works and what not, or even causing us harm. We also urge to at least 50% of EU and national demand reduction funding be allocated to interventions rooted in human rights and social justice, housing, legal support, stigma reduction, and care. This gap between theory and practice is especially visible in outdated opioid agonist maintenance therapy, OMT facilities. Services across Europe still prioritize control over care, offering very limited, inflexible options and ignoring broader needs such as housing, education, social inclusion. We find people left isolated, aging in neglect, while the frontline staff of such facilities experience burnout. We still need a shift toward modern right-based treatment and support systems that are co-designed with the people they are meant to serve. Our members also identified several urgent gaps that must be addressed. It is access to naloxone. It remains inconsistent and inadequate across member states. This is unacceptable. Naloxone must be available freely and everywhere where overdoses occur, in the hands of peers, outreach workers, families, and even in prisons. Especially now with the spread of deadly nitazines, which is not just a health issue, it's a human right imperative. Also, women who use drugs continue to be excluded. They face disproportionate violence, stigma, and the threat of losing their children while seeking help. Yet few policies are tailored to support their safety, autonomy, and care. Gender-neutral policies often ignore that gender realities are ruling their drug use. This must change. Also, the same comes for minorities, including LGBTQ people, Roma communities, and migrants. They remain invisible in most national strategies. Inclusion must be explicit or it will remain absent. If we want drug policies to be effective, it must be coherent. If we want it to be just, it must be rooted in lived experience and in human rights. Thank you very much.
Thank you so much, Masha. And I think it's a really important thing for all of us to consider how, once we have a great EU drug strategy, how we can implement it adequately on the ground. And of course, civil society and affected communities are absolutely critical for that. Ian, I'm going to move on to you because I know you're going to have to leave shortly. So historically, the European Parliament has had a relatively small and isolated role in shaping EU drug policy. So in your view, how can we increase this role and what can MEPs do to support this call that we're making today?
Well, thank you, and thank you for the presentations. I'm always very inspired whenever I come on webinars like this to listen to the real life experience. It's bad drug policy that kills, and that's what we really need to focus on. I suppose the power that we have is the power that we demand in anything. We would have said maybe during the pandemic that the European Union had a limited scope when it came to health policy, but then the pandemic and the rollout of the vaccine proved that not to be the case. And I'm currently on the Housing Committee of the European Union and European Parliament. And previously, we would have thought that there wasn't necessarily a huge competency of the European institution when it came to housing, but that's now proven not to be the case. So I think it requires a little bit of leadership from the elected members of the European Parliament to make this a European issue and a big European issue, and also to push back on some of the misconceptions that are out there. I have to say I am concerned with the rise of the far right. Whenever there tends to be an election in any member state, there seems to be an advancement of the far right. There's 200 or so far right MEPs in the European Union, and you can just sense that they are not going to be particularly progressive when it comes to drug policy. And we also have to, I suppose, push back on some of the myths. So 2 weeks ago, I happened to be in Lisbon as part of my work. My group, the S&D group, had a working week in Lisbon, and I took the opportunity to visit a drug consumption room and to talk with some of the designers of the decriminalisation programme 25 years ago. And in Ireland, if you were to listen to conservative voices, you'd be led to believe that there's a huge conversation in Portugal about rowing back on decriminalisation, rowing back on harm reduction, when that just isn't the case whatsoever. It's proven to be a success, and it's the type of model that we want to see replicated across the European Union. So I suppose what we're trying to do on an informal basis across different political groupings is to have the beginnings of what we would call an intergroup. It wouldn't have any formal status. It can't do that unless it's formulated at the beginning of a mandate. But to get some interest from different groups, different MEPs to begin to take a stand in relation to harm reduction, decriminalisation, putting the user at the heart of European drug policy. I was the Irish Minister for Drugs for a period of time 10 years ago, and so I'm well used to some of the arguments that are made. We pushed very strongly for an injecting facility during my time as minister. It was only opened last December, but I can tell you in the 6 months of its opening, it's had 4,000 visits from 700 unique clients, and it has had 59 non-fatal overdoses. And if it wasn't for the injecting facility or overdose prevention facility, as I think we should call it, that those 59 interventions would have overdoses would have required 59 ambulances on the streets of Dublin, but they only required one. And that's the type of positive intervention I think that politics can make. So I think we have to seize the initiative. We can't sit around and wait for somebody else to do it. We can't wait for strategies. We can't wait for policy documents to drop. We have to react to policy documents. We have to feed into them. But what I think the ownership, the onus is on us as political leaders to reach across party lines or grouping lines and to set out our stall of making this an important European issue. Lots of other things are coming into the climate of European politics. We understand all of that. It's a very tense and very delicate time. But this is the moment, I think, to re-grasp momentum, which unfortunately I feel was lost. For whatever reason, we went into a pandemic. Obviously, we've had a change when it comes to security policy around the European Union. People are very worried about what's happening, obviously, in Ukraine and in Gaza. There's a huge push now for simplification and for a competitiveness agenda. And the Trump regime is making everybody scared about the impact of tariffs. But within all of that, I think what the European Union, when it acts best, is when it puts citizens at the heart of its policy making. We're doing it with housing. We are accepting and realizing and trying to change the reality of the number of people in homelessness across the European Union, which stands in around 1.2 million. We have an issue when it comes to functional illiteracy. We have something like 93 million European citizens who have difficulties with literacy. So when you have the drug issue still causing so much pain and so much hurt, we have to move beyond policing, the criminal justice intervention, the sense that this is something about what comes in or what comes out of a country. We have to get back to the humanity at the center of this entire issue. And it is bad drug policy that kills more so than drugs. It's bad drug policy and bad politicians within drug policy making bad decisions. So I think what we're trying to do is to lift the conversation and maybe to allow for MEPs to take some risks. But the more you do it, the more you realize that people are fair-minded and are willing to move to the next stage. So I think we're going to grab this opportunity over the next period of time. I think our conversations in Portugal 2 weeks ago helped that. We have a new executive director of the EU Drug Agency who happens to be Irish. And I'm looking forward to working closely with her. But we have to seize the moment and the time for waiting for others to come to the fore and to set the agenda is passed. The agenda has to be set by fair-minded, progressive politicians in this space, and that's what I'm determined to do.
Thank you so much, Ian, and it's really so encouraging to see that some MEPs are taking the lead on that, and count on us to support any kind of working group or informal group of MEPs wanting to work on this issue. I'm now going to turn to Joe. So Joe, your unit has been very much involved in the shaping of drug policy, and obviously EU drug policy has been praised for being balanced in terms of demand, supply, and harm reduction over many, many years now. However, as I mentioned in my introductory remarks, in recent years, we have seen a growing perception that funding and actions have overly focused on security measures. So what steps will the European Commission undertake to ensure that the next EU drug strategy is designed and implemented in a balanced way that can focus on evidence and also prioritize health and human rights?
Thank you, Maddie, and thank you for the question. I'm very happy to be here. I acknowledge that perception that has changed. And in a way, I think our balanced and very successful balanced drug policy is a victim of its own success. Overdose deaths, drug-related, have been kept stable. Whereas if you look at the other side of the Atlantic, we've seen an explosion linked to synthetic opioids. This is the strength of our harm reduction, of our health prevention activities, which are leading to that. And on the other hand, we have seen an increase on infiltration of organized crime, this hyper-violence. I think Alexis referred to that as well, which means that the violence and the need to respond to that to restore a bit of public order becomes very visible. But what's very fundamental therefore for us also is, as we're preparing this new drug strategy, to make sure the response to that stays holistic and stays as a whole of society approach. It's one of the elements that came very strongly forward, and I'm very happy about personally is that when, as a European Commission, we launched our Protect EU internal security strategy, what we emphasize very much is an element of whole of society response. Even when we talk about internal security, it requires a whole of society response. This is not a law enforcement dimension alone. This is not a supply reduction dimension alone. We need to look at it holistically. And the very important preparedness element in all of that. You need to have the health systems in place. You need to have the harm reduction systems in place to be prepared for new risks which are emerging, because those are emerging and those are coming out. We saw that in the European drug report of the EUDA, which says there are more drugs available. There is polysubstance use. We see an increase in cocaine use. And I always know, Alexis says, the effects of that, the health effects, you only see those in the longer term, in 10 to 20 years. So we need to prepare now, and with that balanced approach, have it there. How are we doing that to make sure we have that balanced implementation? Well, we learn from the past. One of the things, the first things we're doing is we will come with an evaluation. It's going to come out in July, which was based off the current drug strategy, based on a public consultation, more than 100 interviews we did, workshops with civil society to really grasp as many elements as possible of where has it succeeded, where has it failed. And one of the things you see straight away there, which also Alexis also referred to, is that there's a very patchy, uneven implementation of harm reduction. Yes, we have made it more visible in this strategy, but it's not evenly available across member states, and even within member states, it's not evenly available within the territory. So there's very different realities which still exist within the EU today across the territory, I would say. So learn from that public consultation evaluation, which will come out in July. Secondly, what Protect EU announced is we will come with a new EU drug strategy as Commission. For me, it's very important that as a Commission we come with that strategy, that also as a Commission we see there is a responsibility at the EU level to come with the balanced approach, but in close collaboration with member states. We've really put instead a process in place together with member states in the Council to really do that together, because as Alexis said, it's a shared responsibility drug policy, and a lot of the health policies remain today at the level of member states. So we need all member states on board. And I always go in council and tell them, look, this drug strategy needs to be useful for me at an EU level internationally, but it also has to work for you at a national level, and we need to have that balanced approach at the national level. So second very important element is shared responsibility. Third one, we need to prepare that in a very broad consultation. I think it's the best chance. And so how are we doing that? First, well, I'm here. My colleagues are sitting in the back of this online session, taking good notes of everything that's being said, all of the questions asked. And I want to continue doing that because we're preparing the drug strategy now. If we get invitations, I'm happy to come. I'm happy to listen. I think that's a fundamental part. Of course, me coming to every individual seminar is not going to let us consult everyone. So a second big thing we're doing is we launch a call for evidence very soon, once the evaluation is out in July, to really, and we will spread that through our civil society forum on drugs to all stakeholders. It's going to be available on the, your voice in the EU, where we really call on people to submit evidence, those elements you want to highlight for that next strategy. And then, of course, in that co-creation process with the Council, with the member states, we are involving civil society. I know the Civil Society Forum on Drugs, or expert groups with civil stakeholders, is associated in the Council discussions that we're having, that was done through the Polish presidency. I hope the Danish continue with it. But also we as a Commission want to rely on our expert group, and after summer we will be having an expert session. We are setting that up, all of it, to make sure that we have a session with our experts from civil society to also get that input directly. So it's a big consultation where hopefully we activate the right people into society. Now my bell is ringing very loud. Here we go. That we make sure that we get a good result at the end. Thanks.
Amazing. Thank you, Joe. And thanks for your commitment to involve us as well. We obviously hope that we'll be consulted, and not just the CSFD, but also broader as well, so that other groups who are unfortunately not represented there can also engage and hopefully also be able to comment on the draft of the strategy. Because for us, I think, meaningful engagement means that we'd be able to see the draft and feed into that as well. Moving on to the national level, Lynn, could you tell us a little bit about how EU member states can actively contribute to a collective EU approach that prioritizes health and discrimination, in particular with your incredible experience in Ireland?
Yeah, it's surprisingly a difficult question to answer to some degree, because I know in Ireland, particularly as even as a politician, so someone with a platform and with power still feels disconnected from the EU systems in a sense, or the strategies or the Commission, or even from EU Parliament, even though that there's that connection between having Irish parliamentarians in these spaces. So it is really difficult to answer. I think Ireland, for instance, has had quite a comprehensive conversation on drugs policy in the last 10 years. And even though we could try and take responsibility for communicating that conversation outwardly to Europe or into those structures and systems, I I suppose, want to put a little bit maybe of the responsibility on Europe, and the structures that will develop and will consult on the likes of the EU strategy to be paying very close attention to what's actually happening in member states. I think the personnel and the power and the resources exist outside of Ireland in terms of being able to actually have that thread of the conversation to be happened between individual member states and the EU level. I think in Ireland right now we're having a conversation where there's a massive fear around removing law enforcement in relation to drug decriminalisation. And obviously, my view is we don't have drug decriminalisation if the law has any role in it at all. And I think it's the same can be said for harm reduction. So I feel right now in Ireland, there's a conversation happening, and the EU has maybe a more advanced level of expertise on certain situations, but it's not commenting on the conversation maybe that's happening in Ireland. And it's not actually holding, say, to account the Department of Health or even the views maybe of some of the medical industry in Ireland. Or right now, there's a proposal for an adult caution scheme. They're calling it a health-led approach to drugs. It's actually an adult caution scheme. And I think as policymakers in Ireland, and we're a small country at the end of the day, I think it's upon the Commission, even the Drugs Agency, for them to be commenting actually into the country to say that this is actually not the standard in relation to harm reduction. This is not the standard in relation to drug decriminalisation. And this is not the standard when we're talking about how communities are policed. Right now, our Department of Health has admitted that it's actually on Garda Síochána that will decide how that supposed health-led approach will look. So right now you've guards who have absolutely no expertise other than policing, policing drugs and badly policing drugs, because it's kind of a game of cat and mouse. It's like a Tom and Jerry cartoon just going on and on and on for decades in the sense of trying to reduce supply. But so you have Europe being incredibly quiet about the fact that Ireland is about to introduce a model that further criminalises and polices people, because the only people who will be stopped and searched are people from a particular class. And it is most definitely decisions are made about who is policed and how they're policed. So any piece of legislation and even any strategy, so even the next EU strategy, when it talks about law enforcement or a place of security or supply reduction, it has to have an understanding and a particular class lens to understand that that strategy and the police and practices that will go alongside it only apply to certain groups of people. They only apply to certain classes of people, and they only apply to certain ethnicities and certain marginalized communities. So unless we actually push back against the fact that the strategy itself is classist in nature, if it doesn't call for the complete end of stop and search practices, say across Europe, if it doesn't call for harm reduction, is not harm reduction if people with power decide what the parameters of that harm reduction are. Harm reduction is about reducing harm. So you take policies and strategies as far as they can reach to reduce the harm, and you listen to the community in what they're saying reduce harm. Even when it comes to arrest and, say, the policing of sale and supply, that affects the same community that we're saying we want to protect in terms of health. because you could have an individual within a family who sells drugs, and you could have an individual within the family who has an addiction issue. So whether you police, you actually remove certain working class people from families and homes and communities, and you put them in prison, or they die due to gang related violence. Or if you want to introduce harm reduction and decriminalisation, it's the same group of people that these two things are applying to. And I think unless we centre that in the conversation of decriminalisation and harm reduction, I think we're failing not only to include member states, but to include the most impacted within those member states. And I'll finish on saying why I find it hard to answer how member states can engage in that conversation is because we're failing to include within the member states the actual communities that are most affected by the policies and strategies. And I can guarantee that that is the same experience across any especially Western country, or any country that has colonized approaches to drugs policy. And that's another thing we need to do, is decolonize the strategies, decolonize harm reduction, decolonize the drugs acts. And unless we acknowledge that it's the same communities across all these countries that are impacted, there's no point in just the member states having the conversation. There's no point in just the politicians having the conversations, or the drug services even themselves, because there's a level of gatekeeping and potentially a level of delusion that it's not actually completely classist in its nature in regards to anything that we introduce, because we're very much talking about particular communities. And I think that we've often failed to actually recognise that and address that. So I'll leave it there. Thank you.
Thanks so much, Lynn. And yeah, I mean, it's always the same people who are disproportionately affected by drug policies. It's people from special ethnic backgrounds, it's the poor, it's women, it's, so I think thank you so much for bringing that up. And also your final points on engagement of those most affected links back very well to one of the questions from the chat from Joanna, who asks what EU institutions can do to guarantee the full participation of people who use drugs in all levels of policy design, implementation, and monitorings. Are there any ideas regarding how to fund participation? Because funds are mostly dedicated to service delivery. So is there any idea on how to transit to fund participation more widely? There's also a question from Lee that's related to that. How can we ensure that hard to reach cohorts have a voice in terms of drug policies as well? Lynn, would you like to react to that?
Very, very, very briefly, it's not really a practical point in terms of how, but it's maybe acknowledging what has gone wrong to date. We obviously have many people, and same on this call, people who've used drugs or people who have lived or living experience, have to some degree been, say, consulted or, brought into conversations. The problem is not that. The problem is implementing what people who use drugs are already saying. So it's not even going, how do we include more? It's actually, how are you going to implement the solutions that people who use drugs have been saying for decades? And if we've already failed to implement the solutions that have been continually provided by the people who are already in the room who use drugs, it's very hard then to go, well, how do we make sure there's participation from other people when we can't even point to the solutions? And at the end of the day, like, obviously people who are closest to the issue will always be closest to the solution, but they're only ever consulted. They're not actually resourced or given what's needed to implement the ideas that they have. And I think until we can truly say that we're implementing the ideas and the solutions from a policy perspective, it's very hard to then include other people and show them what empowering them to be part of the conversation can look like, because we can't point to adequate successes, such as what decriminalisation looks like, such as, everybody having take home naloxone without a prescription. Like, all of these things are being said by people who use drugs. So unless we actually implement them, we're already failing the ones that are contributing to the conversation in the first place.
Thanks so much, Lynn. Another key thing that is happening or has been happening for the past 2 days is a meeting of the UNAIDS Program Coordinating Board in Geneva, in particular to talk about the HIV crisis right now, the funding for HIV, and also the crisis that is affecting UNAIDS. And also UNAIDS is in the process of designing its own global AIDS strategy for the way forward. So we have with us Alexei Lakov, who is the executive director of the European Network of People Who Use Drugs. So Alexei, can you just tell us very briefly a little bit about some of the discussions that took place over the past few days and where they're at in terms of the HIV response within UNAIDS?
Yes, thank you very much, Marie, and hello everyone. I am joining you from this UNAIDS PCB meeting, and thank you very much to all the speakers for finding time and sharing your insights. For the last few days, the atmosphere here at the PCB meeting was subdued, to say the least, because we are in the middle of this global HIV crisis. And it seems as if it has happened overnight, you know, because originally I come from Russia, and this is a very criminalized space, especially for people who use drugs, for other key populations. But in our case, it was moving slowly, you know, over the years. So we had time to prepare and adapt. And now with these drastic funding cuts and with these right-wing movements that have already been mentioned, it's going too fast, and the fear is that we won't be able to catch up. And this is why it is really imperative that EU picks up the mantle, you know, and reiterates its commitment to the HIV response. And it could do it by increasing its contributions to the Global Fund, for example, you know, by continuing to support UNAIDS. But first and foremost, it should, and it not even should, it must, absolutely must include people who use drugs as experts and implementers on every page and in every paragraph of the EU drugs strategy, because without us, its success is simply not possible. And in terms of the new global AIDS strategy, yeah, so it will also specifically reiterate the involvement of communities of different key populations. And this is why it's, again, critically important to involve the delegations from the EU member states, such as Portugal, for example, such as Poland, who are already great allies on the PCB floor. And now the new ascension states, such as Ukraine, for example, that is becoming the member of PCB from next year. So yeah, it's critically important, and we really hope that, and we really thank Mr. De Kock for being available to us, you know, and for being ready to organize all these groups in the European Commission. And we just hope that there will be more opportunities for us to engage with the members of the European Parliament, with the European Commission, and with all the other relevant authorities. And by concluding, I want to say that our campaigns coordinator, Joanna Caneda, is sending a letter to members of the European Parliament, and you can also join this statement. Yeah, so thank you very much. The global HIV response is under threat, but we are not losing hope. I think this is the main takeaway from these 3 days. And even though UNAIDS is firing like more than 50% of its staff, and it's closing down a lot of its offices, you know, and it's merging other offices, but still there is hope, and UNAIDS is really keen to listen to the voices of the communities. And we really hope that the European Union will do the same. Thank you very much.
Thanks so much, Alexei, and for the message of not losing hope. And also, you know, that's one of the reasons why we started coordinating the Support Don't Punish campaign in the first place, just to, you know, have this feeling of solidarity and getting together and getting the message across from all corners of the world, at least on one day where we can just stand together. I would like now to give the floor to Ghana Dovpak for closing remarks. I know we're slightly out of time, so please bear with us for a few more minutes. Ghana is the Executive Director of the Eurasian Harm Reduction Association. She's also the chair of the EU Civil Society Forum on Drugs, but today she's going to talk to us in her EHRA hat. So Ghana, you've got the floor for closing remarks.
Actually, everything which we were saying, it's about funding and it's about priorities. And I need to reiterate from all the speakers what we've heard, that if we will hear properly communities on the ground, we will hear that safety, health, and lives of people who use drugs is the main priority of security. And I don't understand, maybe I'm not very good in English, but safety of people and communities is the security. Maybe I'm not right, but that's actually the main point of the European drug strategy, which we want to highlight, because on the ground we see very unequal access to harm reduction, to health and social care for people who use drugs, especially with the migrants, especially for women, for Roma people, for marginalized and criminalized groups. And that's actually the role of European Union and the strategy to prioritize coordination, to support member states in making this access to health equal, and responding to a lot of talking that civil society will find other sources of funding. Unfortunately, as we've heard from Alexei, there are no other sources of funding for the community participation, for engagement, for learning, for regional coordination, and for service provision, a part of EU funding and member state funding. Nothing else. So that's actually why we are calling for our politicians on national level and on level of European Parliament to unite and to support us in this call for prioritizing health issues and health messages and health priorities, health response to drug policy problems in the EU strategy. And that's actually what we want to achieve with all joint effort, coordinated effort of civil society in this upcoming 2025. Thank you, everybody. And that was absolutely amazing meeting, and we need more time and more opportunities to prioritize these issues, and I hope that we will have them in implementing of the new EU drug strategy. So it's not the stop of the day, but it's just beginning. And please make a picture of yourself with the Support Don't Punish logo. Today it's the sign of support and sign of your messaging out that we do need health and support for people who use drugs and not criminalization. Thank you very much.
Thanks so much, Gana. Thank you so much to you all, and stay tuned for the next steps on this dialogue that we're creating here. And yeah, we'll be in touch soon. Thanks, everyone. Have a lovely rest of your day.